So there are three ways that we typically see running injuries happen. One is an accident or a trauma, right? You roll your ankle, you hit a curb or a root on a trail run and you fall. You're unfortunately hit by a vehicle or something like that. Tends to be less often, thankfully. That's something where you're going to see immediate either PT or a physician for imaging, injections, anything that might require more medical treatment there. You're most likely not gonna continue running through that. You are probably gonna end up having to take a little break before you can return to running. The next one, probably most common, is overuse or misuse injuries. So this is too much too soon. This is the runner that just started running, that's already going up within a month to 10, 15 mile weeks, 20 mile weeks, or a runner that's been running for a long time who's just really keeping at a certain pace and jumping up in mileage as well. Essentially what happens is, just like if you try and lift something that your muscles aren't strong enough to lift, your bones, your joints, your tendons, your muscles are not able to tolerate those repetitive loads that go through it when you're running. And so what happens is you develop pain and dysfunction, which then limits your ability to run. The third one is faulty mechanics. So this might be mobility deficits, this might be strength deficits, this might be running mechanic deficits, right? Or form deficits with your running gait. It's things like cadence, things like how far you land in front of you, how symmetrical are your limbs, are you really uneven? These are all things that may contribute to injuries or running injuries specifically, right? All three of these would be things that you should go seek a physical therapist for, especially with the last two, overuse injuries, misuse injuries, and faulty mechanics. These are ones where you really should seek someone who knows what they're talking about when it comes to running and running form.